What I want to show next are the corner stitches. We have a 3-point corner stitch. And a 3-point corner stitch is very typically used when we're dealing with laceration repair. And this would be a scenario where, for example, the individual got cut, and it's kind of a cut like such, where a flap of skin has actually been pulled back away. What we want to do here is you want to pick the skin up. We want to basically undermine the area. This can be done blunt to section wise, or we can actually cut just a tip back. And what our goal with this technique is to stabilize the tip with the corner stitch, and the actual strength then comes by doing simple interrupteds or whatever other stitches you want to along the edge back here to ensure that this does not move. So all we're trying to do with this corner stitch is stabilize this corner, make sure it's level with the surrounding skin. It's not too deep, it's not pulled up above, pulled ahead like such. Just stabilize it so then we can use the rest of the stitches for strength to hold it together. Okay? To do this, we use a different sort of a stitch. Here, we're going to start above the apex or the tip, typically about 1/8 of an inch. I'm going to go into the skin above it, where you can see, but I'm going to stay in the dermis. And as I push through with my needle, I'm going to come out, hopefully here. Actually came out a little high, so I want to back my needle up just a snitch, come out a little lower, okay? And so I actually came out, as you can see, in about the middle of the dermis. Again, I typically pull through all the way. I don't try to do too much all at once because I want to keep control of where my needle is going in. So I keep my needle fairly close to the tip so I have good control. Here, I pick up the flap, squeeze it with my forceps, and then I can go in here at the same depth I went in before, push through, come out the other side. Here I'm coming out, you can see also, about middle of the dermis, and I'm still fairly close to the end of the tip. You can see I'm pretty close to the tip, so I'm going to have good control of this tip to hold this in place. I then kind of see where this is going to lay down on the other side. Again, I'm going to control fairly much where I'm going to be doing it by holding the needle fairly close to the tip, and I'm going to be reaching in to that skin, go into the middle section of the dermis, push upward. I'm sorry, it looks like I tore just a little bit. Push through. And you see I'm a touch short here, but I'm still up above the actual tip. I'm going to pull through the skin like such. And then when I tie this off, you can see the tip is laying nice and level with everything else. I'm just going to tie this off in a manner lightly, just to snug it up so it's going to stay at that point. Not putting a lot of pressure on it. Just want to maintain just the stability of this tip. Okay. Notice it's level. I can hold, the tip is being held in place. It's level with the surrounding skin. And then I would finish and complete this off by putting simple interrupteds or whatever else I felt I needed to along here to support this. If this is too wide up here and you snug it up, it's going to put a crease in the center, which will not allow these tissues to come together smoothly. You also want to make sure that the cross here, where you tie from one side to the other, is above where the actual tip is. So the tip is in there. I can see the tip clearly, and my lineup is above it. I would optimally like to go about 1/8 of an inch above. But this pig skin is extremely soft, and what I'm noticing is that it tends to bunch up underneath a little bit. So it actually was a little higher up, but because of the softness of the skin, it actually appears to be closer than it should be. But you're shooting for about 1/8 of an inch back from the edge. Just stabilize the tip, don't pull too tight, and then finish it off with simple interrupteds. So that is the 3-point corner stitch.